I appreciate it. I'm trying to figure out how to do the background so you won't know I'm in the car, but nevertheless, I want to truly thank you for this hearing and thank the panelists. This is a great hearing, a much-needed hearing, certainly something that we in the state of Georgia, this is important because I will tell you that we've been working for the last 2 years to try to figure out why almost 1 million Georgians that are uninsured and are eligible for subsidies under Obamacare have not enrolled in the exchange. And about a little bit over 150,000 of these that are eligible for the bronze plans would have 0 or single-digit premiums per month. And we found that there are really 2 issues. First of all, we need to get to the people where they buy their insurance, and secondly, the insurance is still far too costly. On the first issue, and that is about getting the people to the insurance. Georgia's proposed not using healthcare.gov and instead using a network of private web browsers, such as our web brokers, I should say, such as Health Sherpa or Get Insured and other health insurance carriers to find people where they are. And what I wanted to ask you, Mr. Cameron, is have you found that brokers, in your experience, are more successful enrolling people than federally trained navigators?
Absolutely, Congressman. I will tell you that Idaho has its own state-based exchange, and we did it for some of the same reasons you've talked about. We're the only Republican state that has a state-based exchange. We'd welcome others to join us because we think it can be less expensive and be able to reach more people.
So not using healthcare.gov has not hindered enrollment in Idaho?
Not at all. That's not our issues. Our issues are affordability and those folks who don't believe they need the coverage.
Okay, so that's the first problem that we had. The second problem that we've had on the second issue, Georgia's 1332 waiver is also planning a reinsurance model so that we can lower premiums up to 25% in some rural areas where there's less competition. And listen, there are 2 Georgias. There's Atlanta and there's everywhere else. And in South Georgia, it is a problem, a big problem. We don't have as much competition as we should. But if we were to do this, Mr. Cameron, can you talk about how reinsurance in Idaho and how it's helped to lower premiums?
You bet. And first of all, we didn't use the 1332 waiver. We attempted to, frankly found that the 1332 waiver process was too cumbersome and too difficult for what we were going to gain from it. So we just adopted our own program. We look prospectively. We have 1/4 of our premium tax looking prospectively is deposited into our account. We set up the reinsurance process with a board that I appoint that is made up of both consumer advocates as well as insurance carriers. And the insurance carriers have to pay a premium in order to buy the reinsurance. Plus, they can be assessed if we ever get upside down. We're not. We're operating in the black with several $1 million carrying over from year to year. And it does help reduce rates. And we hope it will reduce rates more significantly down the road as our pot continues to grow.
Well, we may reach out to you to find out exactly how you were able to do it. We're trying to do the 1332 waiver in the state of Georgia, and I hope that this administration doesn't think that it knows better than what we know in Georgia, what we need, and I hope that the flexibility that the 1332 waiver offers is absolutely crucial to getting more Georgians access to quality, affordable health insurance. So we'll be monitoring this, and Mr. Cameron, we may be in touch with you to find out how you could help. But my message is simple, and that is we don't need to be litigating this 1332 waiver. This is something that's extremely important to the state of Georgia, and I hope that we'll be successful in this. And with that, Madam Chair, I'll yield you back 30 more seconds.
We thank the gentleman.